Yeah, what about finasteride, dutasteride, and these drugs that are effectively DHT blockers? Cause people lose their hair, typically up front or in the back, so-called crown or whatever, or everywhere in some cases. It also induces hair growth on the back, beard growth, as we understand. But then people go and take these drugs to try and maintain or grow their hair, and oftentimes they have erectile dysfunction or other issues. Is that surprising to you?
I think the men that we see these side effects tend to be younger men in their 20s, 30s, and 40s, and they take it, as you're pointing out, for hair loss. So before it was FDA approved for that indication, at least finasteride was, they did randomized controlled trials to look. And one of the other things that we'll talk about too is just reproductive effects. So they did lots of studies to see if there were changes in semen quality for men on finasteride versus the placebo, and there were some very subtle changes. But sort of in post-marketing now, we see these patients in clinic. Everybody to enroll in these studies had normal function. So I think that's sort of important to understand. And obviously that's not life, right? That people come in with sort of different baselines and different amounts of reserve. And so we now know that there's probably people that are a lot more sensitive to these